Cancer is a big topic that is oftentimes scary, but here's the thing. What I have found is that the best defense is a good offense. Taking time to learn how to detect and know what's going on well before you get to the point of a later stage in cancer is where it's most important. Listen to this amazing Q&A live where I go through all things ovarian cancer so that you can armor yourself for health and wellness. Hi, my name's Dr. Laura, and on this channel, I help you gain optimal health through knowledge and movement. Hi, I'm so happy to be going live. It is Ovarian Cancer Awareness Month, officially in September. And I just had, hello, thank you for the love. I just had an amazing blog go live where I outlined all of the things to think about when we're wanting to screen ourselves and become more aware about ovarian cancer. So, I think that one of the most important things is that we are aware of what signs and symptoms can look like so that if we see something, we can make sure to advocate with our providers. So as I go through kind of talking about ovarian cancer and asking some of the questions or answering some of the questions that were asked, and if you guys have any questions, please just pop them in the comment box and I will be so happy to answer them. But basically, I just wanted to take a moment to kind of dive in a little bit more and give you some one-on-one talk time with me around this really kind of broad and sometimes even scary topic. I mean, cancer can be something that can be pretty scary at times. So let me first kind of give a little bit of a background about what ovarian cancer is, because it is one of the types of cancer that is oftentimes caught much later in its later stages. So think more like stage 3 and 4, and as a result, it is much harder to treat in those later stages. So ovarian cancer, even though we think of the ovaries, it actually is something that starts in the fallopian tubes. So those are the tubes that connect the ovaries to the uterus. So that's where they think that a lot of ovarian cancer starts, and then it will move to those ovaries. So any individual who has ovaries, has fallopian tubes, can be at risk for this. So this can be natal females, so individuals who are cisgender females. It can also be transgender men, individuals who are intersex. So I think that it is really important that we don't think of this solely as a women's issue. It's actually a lot of individuals who can, excuse me, a lot of individuals who can get ovarian cancer. So that is something to think about. Now, if I pull up my article here, because I didn't want to say something incorrectly about some of the signs and symptoms. Hello, thank you for joining. So ovarian cancer is something that oftentimes will start, like I said, in those fallopian tubes in the ovary. And the ovaries, when we're thinking of where they're located, and oftentimes this is something that is maybe being pushed on during your pelvic exam and you don't even realize it. So it's actually in the lower part of your abdomen. So if I move my tripod back here, and I stand up so you can see my tummy, our ovaries are going to be right down low here. So I have high-waisted pants on, so you can see I have my hip top of my pelvis here. If I come in, you can feel my pelvis in here. So they're going to be nice and low and in here. So oftentimes when you are being assessed by your doctor, they will do what's called a bimanual palpation. So they will have one kind of finger inside and then the other one will be externally, and they'll kind of squish and be able to press on the ovary to be able to assess that area of our body. So that's where when you think about where are the ovaries located, that is where they're located. And now, as I said earlier, this can be any individual who has ovaries. So females, intersex individuals, transgender males, anyone who has ovaries can have this, okay? And the other last thing that I want to say is this is something that's often caught in later stages because the symptoms are very vague oftentimes and not something where people will go in and get assessed. So as I'm talking here, if you guys have any questions as it pertains to ovarian cancer or treatment for that, please, please, please let me know in the comment box. So when we think about signs and symptoms, this is actually where a lot of my questions came in with Instagram stories. And I even got one question on in my feed. So the signs and symptoms can be any type of abnormal bleeding or discharge. So if you think about it, I know I've had some individuals report to me, well, I typically had my period, but then I just started kind of having some abnormal discharge. It was kind of, it had the color as if I was having my period, but I knew it was not that time of my cycle. So if that's something you notice, I will oftentimes have people track. I encourage tracking your period. There's a lot of amazing period tracking apps out there. I honestly will just use my Google Calendar and I can just change the kind of put a little like a meeting note on there, and I can have a little color, and then you can really know, okay, this is when I'm getting my period. And if you're getting abnormal bleeding outside of that, that's something again that you want to report. Let's see. We had a question come in. I just noticed this new feature. Is it abnormal to not get your period when you are taking birth control? So that can oftentimes depend on the type of birth control you are taking. So that's a great question as it pertains to this sign and symptom. So I personally have an IUD. I have the Mirena IUD. So that has some hormones in it. And as a result, my period is supposed to become less and less and less and even potentially go away. Even though it should go away, the bleeding part of it, your body still will naturally cycle through. Now, if you are taking something like the pill, that actually will pretty much shut everything down. And then when you take the sugar pills, then you will release the egg and have your normal ovulation and cycle. However, after working with so many individuals over the years, everyone is different. So if you have been set and you haven't had your period for a very long time and you are on birth control and then suddenly you get this abnormal bleeding and it happens, you want to let your doctor know, okay? Because that is out of the ordinary for you. Another symptom that can come up is pelvic pain and pressure. So this is one that's really huge because a lot of times for me personally, I'm seeing individuals who have pelvic pain. So that was another question that came in, which is, how do I know if my typical pelvic pain is normal, or how do I know I'm not starting pelvic pain versus having a sign and symptom of ovarian cancer? So with this, we're thinking about 2 weeks. So 2 weeks is sort of our determining factor. So if I suddenly have onset of pelvic pain, or I suddenly have urge incontinence, fatigue, pain with sex, back pain, I have constipation or abdominal bloating or swelling, and these symptoms last for 2 weeks, and I'm trying to do my typical things to make it better. Say with constipation, I'm increasing fiber, I'm taking some Miralax. Say with my pelvic pain, I'm taking pain medicine, and it does not seem to change, then you need to go into your doctor. And I would even say if those symptoms last and it's not even a 2 weeks straight, but it's like, gosh, I just kind of feel like they were sort of present the entire time, then you want to go into your doctor and alert them to what is happening. Because at that point, the doctor should, and I say should because a lot of times you are most likely going to have to advocate for yourself. They probably will say to you, oh, are you sure it was 2 weeks? So this is why I'm a huge fan of putting on your cell phone, or if you have a paper calendar, or emailing yourself or whatever, writing down, this is when my constipation started. It started on, so today is 9/10. It started on September 1st. That's when I noticed it. I tried taking Miralax. That kind of helped, but not really. I just felt unwell. I still had some bloating. I tried increasing my fiber, drinking water, and list everything that you tried. And then you're like, okay, now I'm here and I'm still not feeling back to my normal self. I want to check it out further. And then that's where they should say, okay, let's go ahead and do that. And when we go to check it out further, there's a few different ways that we can do that this can be assessed. And this is another thing why I think this article, if you haven't read it, it's up on my blog, laurameihofer.com, right now. And if you have a hard time remembering, because our blogs go live on Tuesdays, you can always join the newsletter, which you can access with the link in bio, the link in my bio, and you can sign up for that newsletter. So the thing with ovarian cancer is there's really only one true way to test if there is cancer, and that's to do a biopsy of your ovary. So a lot of times we don't want to jump right to that because that's really, really, really extreme. So first, you want to do the doctor will do a vaginal exam where they'll take a gloved hand with lubricant on the finger, and they'll go ahead and they'll push and palpate within the vagina. And then again, they'll probably push externally on your tummy, squeeze to see if there's any pain or if they feel any weird masses. They'll also do a rectovaginal exam where they will have again, gloved hand, and they will put one finger in the rectum and one finger in the vagina, and they're going to feel for any masses. So that's the first way to test. Another way to test is to do an ultrasound. So the ultrasounds kind of look like like a long sort of wand. Usually they put a condom on the end of it. Again, they lubricate it. They place that in the vaginal canal, and they're going to want to turn it because they're going to want to try to get a view of your ovary. So again, same thing. They're going to be pushing usually on the outside of your tummy and then on the inside with the wand, so that, hello, thank you for joining, so that ovary kind of gets squished between and we can get a good view of that ovary on both the right side and the left side. A lot of times this is something that can be uncomfortable, so making sure that you do your deep breathing and all of that to help with that is really important. And then the other test that they can do is a CA125 test, and that is a blood test. And what that is looking for is it's looking for elevated levels, which is something that cancerous cells for ovarian cancer can release and put into our bloodstream. Now, it's important to note that sometimes we can get a positive CA125 test, and non-cancerous cells can give us those elevated levels, and sometimes cancerous cells will not be releasing enough of that. So this is where it's important, where a healthcare provider is taking what you're telling us, what they're finding in their physical exam, and then what they're finding in their diagnostic tests. And they should be looking at all three of these things to come up with a picture for you so that they can figure out what are going to be our next steps. And so that is why I think for me and for my platform personally on Instagram, on YouTube, on my website, is I want you to kind of have this view behind the curtain of what a provider is doing and thinking so that you can advocate for yourself. Because if a provider is not listening to your full history, if they're kind of poo-pooing it, then you need to find yourself another provider, because we are in the service industry and we are here to serve and listen to you. Okay. If they are not doing the physical exam piece, then same thing. You gotta find a different provider, because you want someone who's actually going to look and assess at the area that we're concerned about. And then finally, yes, we don't want to just be running tests willy-nilly, but if we have something that concerns us from these other two areas, it would be advantageous, it would be a good idea for us to have this further testing done, okay? So when a provider is looking at you, when they're talking to you, if you can come in and really paint a clear picture to say, these are the symptoms I'm feeling, this is when the symptoms started, this is what I have done, this is how they have changed based on what I have done or not changed, and this is how I'm still feeling, then that way they really, really can see and put together your picture, versus you kind of coming in and saying, I kind of have felt unwell, but I'm not really sure. And so start kind of documenting and taking your own notes as you go through if something like this pops up. So after you've done all of these, one of the things that they will go ahead and do is, after they're like, okay, your history seems like something sinister is going on. We did the physical exam. It's telling me something's not right. We ran these other tests. It looks like there might be some type of tumor or cancerous growth on one of those ovaries. Now, the next thing is we need to have you go to a oncologist. Now, this is something that I'm hugely, hugely, hugely passionate about, is going to the right provider. So if you have ovarian cancer, or if this is something you are diagnosed with, I don't want you to go to a general oncologist. I think it is very important to go to an oncologist who specializes in treatment of this condition. So this is going to be a gynecological oncologist. And what that means is a gynecological oncologist is going to be someone who understands how to treat cancer of the reproductive system, specifically of the reproductive system for the ovaries, fallopian tubes, uterus, cervix, vagina, and even vulva. So that is who we want to go to. The reason why we want to go to someone like this is because they are going to understand what type of medicine you're going to need. So with chemo, radiation, and oftentimes with this type of cancer, you're going to need surgery. So they're going to understand how to balance both of these. And you want someone to fully assess based on the stage you're at, based on what the different findings are telling them, what your best course of treatment is going to be. If we go to a general oncologist, they are not going to be able to craft the most directed plan of care for you. So I think that is something that is hugely important, is making sure to go to the right provider. And in this situation, it's going to be a gynecological oncologist. So once you go to a gynecological oncologist, say that 5 times fast, they will oftentimes do a CT scan, because this will, again, give a better view of your abdominal canister, so they can see if the cancer has spread to other areas, and this helps them in figuring out their plan of care. This is oftentimes where they will do the biopsy to figure out what kind of medications are going to best serve you in this situation. Hello. So that is something that's hugely important. And then finally, the thing that I think is most important for your care team as you're going through this is to loop in a pelvic floor physical therapist. So as I said, for treatment of this, you're going to have to oftentimes go through some type of chemo, radiation that has lots of different side effects that can cause constipation, that can put you into early menopause, where you can have vaginal dryness, you can have tissue changes at your vulva. It can cause you to have some urinary incontinence issues, different things like that. The surgery can cause for some different scarring depending on what they have to go in and do and remove and all of those things. So looping in a pelvic floor physical therapist along this journey is something that I think is hugely important. The reason why this is hugely important is because you want to get a sense of what is your pelvic floor function now, pre-surgery, ideally, if you can do that, pre-chemotherapy and radiation. And then if and when your function changes, you have that guide so that you can start to work on those changes and see them and start to head them off before. So a lot of individuals who are going through cancer treatment, who are cancer survivors, there are a lot of great resources out there for them. The nurses are amazing, the physicians are amazing, which is great. But a lot of times these providers are not really educated in the nuances of pelvic floor range of motion and movement, recruitment, how the pelvic floor should interact with our tummy, with our hips, our back, our butt. So being able to really understand how that all works together, and be able to see as you go through your treatment process is something that's really, really important. And again, oftentimes what I am seeing is that the patients are having to ask their providers to come and see me. So until providers start being more aware that we exist, I think the best plan is to make sure that people know we exist so that should something happen, they can ask for us. So that's my kind of main soapbox when we think of ovarian cancer. I think one of the other things that is really, really important to note is, and what I actually found online, and I put this in my article, was that from age 18 to 35, every year you should be getting an annual vaginal exam. And then starting at age 35 and up, you should be getting a recto-vaginal exam where they're palpating or pushing on, feeling essentially, both internally at your vagina and internally at your rectum at the same time. Now, I just turned 35 in June, and honestly, I'm pretty sure I cannot tell you the last time I got a pelvic exam. I've asked for one, and my provider just tells me, well, you've been with the same partner, you don't have any abnormal symptoms. The last time you got tested for STIs, you were good, so you don't need to be tested. But here is the thing. This is our first line of defense. This screening, when we go in for our annual exams, this is how we ensure that we are optimally healthy. A pap smear, that's where they stick that speculum in, or that duck-shaped thing where they stick that in and they like creak it open so they can really see in your vagina, and then they swab it with a swab. That is testing for cervical cancer. So, and that's something that we will talk about. But basically you have this uterus, and at the bottom part of the uterus, we have this thing that sort of opens and closes and all of that. And when they swab it, they're looking for abnormal cells on your cervix for cervical cancer. So that is not testing for ovarian cancer. So ovarian cancer, like I said, is something that's tested by pushing on and doing these vaginal exams. And based on the National Ovarian Coalition, they're saying that this should be happening every single year as a first line of defense. So if you have not gotten in to get your annual exam, please go in, advocate for yourself, make sure that you are questioning your provider, be an active participant in your care. It is awkward, it is weird, but it is something that is hugely, hugely important, because I can tell you, in working in a major medical institution, they fill your list or your day with so many patients that it is very, very challenging to see every patient and do a good job with every single patient. There is a huge problem in the United States with caregiver or provider burnout. And as a result, when you go to see your provider, you might not be getting them at their best. And when it comes to my health and wellness and screening for cancer, I want to make sure that I'm getting my provider at my best. So honestly, when I do see providers, I tend to schedule early morning appointments because they're the freshest. They've seen the least number of patients, and I try to schedule earlier in the week so that they are not tired and exhausted from seeing a ton of patients all week. And I try to come in with a list of questions and concerns, and oftentimes I email them or I message them through the secure patient portal to give them a heads up if there's anything specific that I truly want to touch on in our session, so that they can come in feeling prepared to meet all of my needs. And I will schedule multiple visits if need be, just to make sure that I get everything in and that I have those touch points. So, it's something that I realize I am extremely lucky to be able to do. I am white. I am upper middle class. I am educated. And so these are all things that allow me to go in and more easily do that. So if you have any friends, if you know of anyone who does not fit in with those categories and needs more help with those things, please send them my articles, let them know about my blog, because everything I'm doing, I'm trying to help better arm you all so that you can be just as educated as your healthcare provider, so that you can get the excellent care that you deserve, because that is just what it should be at baseline. And if you have any questions at all, you can always message me at hello@laurameihofer.com. If you are in Minnesota, or if you are willing to travel to Minnesota, I am more than happy to see you for any of your pelvic floor concerns. It was such a pleasure taking a moment tonight to talk to you about ovarian cancer, screening, diagnosis, signs and symptoms. Please share this IG Live with anyone that you think would benefit from it. And I look forward to speaking with you more in the future. Have a wonderful night, everyone. Bye.